What are the different considerations for implant overdentures? The number of implants, the position of implant, the selection of attachment types, and what are the complications? So all things needs to be evaluated. Evaluation of a missing hard or soft tissues, proper lip support and aesthetics, restorative space, vertical restorative space, or a vertical dimension of the occlusion for the patient. Whether the implant overdenture will be only a retentive or only the full completely supported by the implants. So that's whole uh, holistic approach needs to be given when you are considering this kind of patients for the completely dangerous patients. When you look at the treatment options, number one and number two are removable options. Num- so these are basically less number of implants. When you see the mandibular arch, two implants is minimum standard of care. So two implants can hold denture is a retained option. When you look at add few more implants like a three implant, four implants, or five implants, and if you join together, that becomes a splinted implant hold denture therapy. The denture is still removable denture. Patient can every night can remove and put it in, and then you can use it back in the early morning again to for the whole day usage. So basically number of one and number two is number one has less number of implants, and most of the support of the denture is actually partly gained by the implant and partly by the tissues. However, most of the times in option number two, the most of the support is only bared by the implants, and the denture flanges are not really touching to the denture to the mucosa. So number three option and number four option are fixed options. So number three is like a hybrid denture. They are still like a metal framework supported denture. The teeth could be uh, acrylic teeth, pink acrylic, which will be adhered to the metal base, and this metal framework is actually attached or fixed with the screws. So there are five implants, five screws are there. So you can remove that denture whenever it is possible for the maintenance purpose. So that's still a retrievable option, and that can be also considered as screw retained prosthesis. The number four, the option four is like a completely fixed implant restorations with a metal ceramic or zirconia restorations. So they are like need a little bit more number of implants, 6 to 8 implants to cope up with the giving the support as a final fix prosthesis. So that is like a clear cut fixed restoration, multiple implants needed for to support this, and you so, of course, so that's exactly these are the four options you need to take apart. When you look at the option number one and two is a removable overdentures. There are some differences or the classification based on the overdenture options, whether implant supported, whether they are mini implant, whether industrial or periosteal implants, selection of abutment, whether is what is the location of the implant, how many numbers of implants are being placed, and selection of the implant site, whether so it's the same again, whether it's abutment selection and the implant selection, both are different stories. So when you look at the classification of the conventionally with a tooth supported overdentures, maybe with or without coping. With the attachments, you will have to place it either it's a stirred attachment or a bar attachment. So now stirred attachment can be of a ball and socket, or nowadays many attachments are coming up in the market are called as a low height or low profile attachments, which are whether it's a locator or actuator attachments, and then the other one is a magnet type of attachment. So all these are types of stirred attachments. They are individual attachments, they are not splinted attachments. So one attachment, the male part will go and fix onto the implant. The female part, the flexible component goes inside the in the denture. And that's how the frictional resistance of this flexible component will give a snap fit fitting to the denture. Thus, they improve the retentive ability of the dentures. So this is typically a schematic diagram indicating that how the ball and socket joint works for these types of overdentures, mainly with the use of stud attachments. So this is the example of a bar attachments where you can see now 1, 2, 3, and 4 implants are anchored in the bone. However, all four are joined with the three bars, and every three bar will be having their separate clip. So three bars which are supported by the four implants. So every bar will be having a half round cross sectional shape clips. So these clips are actually giving the retention, and generally the splinted implants will be providing a little bit more support, and the after forces are more transferred to the implants rather than the mucosa. However, less number of implants, unsplinted implants, they will be only giving the retention to the denture, and then the most of the support will be gained by the tissues and partly by the implants. Okay, so the magnet type of attachment is also used. They are very easy to handle, mainly in a very old patients, geriatric patients where they don't have much of a manual dexterity and so on. So those are the patients are chosen can be chosen for selection of the magnet attachments because they are not really very retentive, but they are retentive enough to maintain the denture in place, and typically being used should be used for a very old geriatric patients, because many times very old patients may not be able to handle these attachments, which are stud attachments or the bar attachments, which are very difficult to handle sometimes for these types of patients. So magnet attachments works well for them. So when you look at the number of implants in the mandibular arch, whether it's one, two, three, or four, usually all implants are placed in the interforaminal region, right? Mental foramen to left mental foramen. Whatever amount of space is available, based on that, you can actually choose whether you will be using five implants or four implants or three implants or a single implant as well. So both all the options works well. Uh, Having said that, the implant placed in general in the canine position at the number 2 and 4 position is the most preferred treatment option, as long as the cost to benefit ratio of the whole of the treatment option is concerned. So in a maxillary arch also you can place 2 to 4 to 6 implants. Generally, the literature was indicating that four implants in the maxillary arch are more preferable than the two implants, because in that case then you can actually remove the palatal portion of that those dentures. Four implants, why? Because probably only two implants are not really enough to support this whole of the palatal portion, and then most of the times the palatal portion of the gingiva is quite thick, and then the occlusally the chances of denture rocking is more, and that's how probably that is more detriment onto the only two implants supporting overdentures. So for maxillary arch, evidence is inclined towards putting minimum four implants as compared with the mandibular arch with the two implants.